Hi everyone, my name is Mario, and today we're at our Seed Farm Pavilion at Huhuka Memorial Hospital, and we're going to be hanging out with our podiatry team. So come with me as we meet some of their staff and learn about their programs that they offer. Let's go.
Hi, I'm Dr. James Longton. I'm the director of the Gila River Podiatry Department.
So Dr. Longton, thanks for having us here. Tell us a little bit about the department, please.
Gila River Healthcare Podiatry Department consists of approximately 50 staff members, including 13 full-time podiatrists. Podiatrists attend a 4-year specialty school, much like optometrists and dentists, allopathic physician, osteopathic physician. We also have to complete a 3-year medical and surgical residency afterwards in order to practice in our field. We have 3 locations, Red Tail Hawk, HHK, and KHC. We also perform on-site services at the Caring House, as well as Ak-Chin Clinic twice per month. We treat all types of individuals, from children to adults. We provide routine foot care services. We provide comprehensive diabetic foot exams. We also evaluate for and perform elective surgeries at outside facilities, including surgery centers and hospitals in the Valley. We are so fortunate. We moved here a year and a half, almost 2 years ago now. Here at Seed Farm Pavilion, we have 18 treatment rooms. We have 2 wound RN treatment rooms. We have plenty of space for our patients to be seen and taken care of as often as they need to be.
Dr. Longton, one of the things you mentioned was the routine foot care exams. Maybe tell us, why is that important?
Well, you probably didn't know this, but the average person will take over 216 million steps in their lifetime. So it's extremely important to see a podiatrist at least once a year. And if you're diabetic, it's even more important because we want to evaluate your risk level. You can always give us a call at our main number. You can get a referral from your primary care provider. We also try to accommodate all standby patients same day as much as possible.
Hello everyone, my name is Dr. Cho. I've been a podiatrist for about 20 years, and I've been with Gila River Healthcare for about 7 years. Mario, thank you for being with us today, and let me show you one of our exam rooms.
Okay. So, Dr. Cho, when our patients come for their foot exam, what should they expect?
That's a great question, Mario. Let me show you. So first, one of our medical assistants will bring you into the room and have you take a seat in one of our treatment chairs. Have you take your socks and shoes off. So one of our podiatrists will examine your skin for any conditions. We'll check your nerve for nerve function. We'll check your feet for blood flow. And we'll also check your muscles, tendons, ligaments, and joints and bones. So this is our handheld Doppler device. And what we do is we position over arteries, and we can hear the sound of the blood flow. It tells us the amount of blood flow, the type of blood flow, the health of the arteries, and then if further concerns, then we can also refer out to blood flow specialists.
Okay, I didn't know that.
For nerve testing, we use a Sims-Weinstein monofilament device, and we'll perform tests on specific parts of the foot to see what their nerve function is like, and this lets us know if they're at high risk of developing foot ulcers in our diabetes population. We also have other devices like tuning forks. This also tests for nerve function and tickles sometimes.
Yeah.
Okay, and then we also have a thermometer that we use on the foot, and we can look for certain medical conditions. For some of our patients, when we do procedures, we need to perform anesthesia. And we make the anesthesia, or the needle entering the skin, less painful by using this cold spray. We'll just a very, very cold spray. We spray before we inject, and it makes the experience much more pleasant. And then the other things we'll check is range of motion, strength. And then we also use some foot models to better explain to the patient about their condition, and we try to answer their questions as thoroughly as possible so they understand what's going on, and we discuss treatment options that is best tailored for the patient. So we can show them, say, where a broken bone is. It's the broken bone here or here in the toes. You mentioned earlier bunions, that's when the toe goes like this, and we can educate them, explain to them, and answer their questions about those conditions. A lot of patients come with heel pain or pain in the ball of the foot. Sometimes, ankle fractures, and we can explain that using this. This shows the bones also, but some of the tendons, the Achilles tendon, and the plantar fascia. A lot of our patients have plantar fasciitis pain and heel pain, and we can use this to help that. We just encourage our patients to, feel free to give us a call, come in. If they have any concerns, don't wait. We just want you guys to, keep your feet healthy, and to do that, we want you to come in regularly with any concerns.
Dr. Cho, one of the things you mentioned was toenail fungus. Tell us how we treat that here.
Well, I'm glad you asked. Toenail fungus is one of the most common concerns that our patients come in with, and we have many treatment options. At Gila River Healthcare, we're fortunate enough to have and to provide toenail laser treatment for our patients. The treatment itself is very high tech. It sends a specific laser type to the patient's foot, and it kills the toenail fungus in the toenails. Now, because toenails grow so slowly, it takes about 6 months to a year to grow new toenail, the results aren't seen very fast. We can provide treatment and they can see some improvement in their toenail appearance.
So the three-dimensional scanning technique is newer technology in order to be able to capture the shape of your foot. We do this scanning non-weight bearing. We put your foot in what's called subtalar joint neutral position, and we're able to capture the exact functionality of the major joints in your foot.
And then what do you guys do with a 3D scan?
We send those to the lab that is remote. They can download those images electronically, and they return the devices back to us in 2 weeks.
2 weeks. And then you mentioned about the Brooks shoe. Once the device comes back, and then how does that work, that process?
So if you're diabetic, you qualify for 1 pair of Brooks Extra Depth shoes per year. We will size you professionally using a Brannick device, and we'll be able to get the exact size that's right for your foot. It's really important. Most people are not wearing the correct size shoe, and they don't realize it until they come see us. We also have the Ultra Mist treatment here, provided by our wound RNs. It helps clean the wounds. It helps also with revascularization to the wound bed. And this is Monica Flores. She is one of our wound RNs. They are specifically trained and certified in being able to apply these dressings. We have several patients who have wounds that are related to swelling in their legs. We have wound nurses like Monica who are amazing at applying these dual layer or triple layer compression dressings, which is what you see here. It is specifically medicated so as to be as pain-free and comfortable for the patient as possible. Top of the line, as good as any wound clinic in the country. We are fortunate enough to be able to apply those as frequently as the patient needs.
So big shout out to our podiatry team. We really appreciate all the information that they shared. Remember, if you want to schedule an appointment with the team, please give us a call and we'll be happy to do that. Until then, have a great day.